Hello. From classroom teachers to auctioneers to fitness instructors to musical theater performers and many professionals in between, there are countless individuals who rely on optimal vocal health in order to perform their jobs effectively. Vocal warm-up strategies can be a very important piece of the puzzle for these individuals. So what is the goal of a vocal warm-up strategy? The goal is to optimize laryngeal physiology and set a person up to do whatever vocal requirements they have for their day. So when we look at a bunch of different warm-up strategies, vocal warm-up strategies, we realize that there is limited evidence for many of the vocal warm-up strategies, and a lot of them don't have any scientific basis. A handful do, and we're going to look at those. So we're going to start with external hydration with steam. So this superficial hydration with steam, it moistens the upper vocal tract and the vocal folds, and it addresses vocal desiccation, which we know is particularly problematic for people that are already vocally fatigued. They are susceptible to this vocal dryness more than others. And we also know that many speech pathologists recommend steaming to voice users as a part of their just healthy vocal hygiene. There's also a ton of evidence to support semi-occluded vocal tract exercises. So we know that semi-occluded vocal tract exercises increase intraoral pressure and improve the impedance match at the level of the vocal folds. And there are many different types of SOVT exercises, including lip trills and tongue trills and humming, and the list goes on. So our hypothesis was we wanted to look at steam by itself, SOVT exercise by itself, and then look at them combined and see if combined steam and SOVT would be more effective than either SOVT or steam separately. So we had 12 participants. We had 12 female speech-language pathology graduate students ranging in age from 22 to 36 years old. And they participated on 3 different mornings. And each of the mornings, they would do one of 3 different conditions that I outlined before. One of them was steam, one of them was an SOVT exercise, and the SOVT exercise we chose was blowing bubbles through a straw into a cup of water while phonating, and a combined condition. So why did we choose this exercise? The reason we chose it was because we wanted to use a dual source SOVT exercise. So that left us with choosing between lip trills or this blowing bubbles through a straw, or there are others, but we chose the blowing bubbles through a straw into a cup of water because we felt that functionality, it's pretty functional. People have cups, they have easy access to water and straws. And feasibility, we felt that while we know many people aren't able to do lip trills, that we felt that more people would be able to achieve this exercise. All right, so we trained the participants on the PTP task about 5 days before the experiment began, and we also trained them on the warm-up tasks. We coached them as needed so they became familiar with the exercises. And then we gave instructions for the morning of the study. Now, we also sent these instructions out in an email every night, the night before they would come in for those 3 days. So the instructions they got were that we wanted them to be awake for about an hour. We did not want them to shower because obviously we don't want them to have a treatment of steam in the shower before they come in to be given steam as a potential warm-up strategy. So for that same reason, we instructed them not to have hot drinks or food before coming in, and we wanted them to use their voice minimally because, again, we don't want them to warm up their voice before they come in to see if these things warm up their voice. And then we asked them not to exercise because there is data to suggest that exercise also warms up the voice. So we asked them not to do that, and all the participants reported complying with these requirements. So we used the phonatory aerodynamic system to measure PTP before and after each condition. And we also asked each participant to report anecdotally how they felt that condition worked as far as warming up their voice. So steam, looking a little closer, we had a personal steam inhaler. The vents were in the openmost position. The steam was already bubbling. or flowing, I guess you could say. The participants would sit comfortably, place their face over the mask, and breathe calmly for 3 minutes. Now, one variable here, or one variation on this, was that for those people that found the steam to be just too intense, we allowed them to lift their face about 1 inch over the mask, and we felt that that would enable them to get a little relief from the intensity of the steam, but also to experience the full effect of the 3 minutes of steam. For SOVT exercise, we had people blow bubbles through a straw into a cup of water while phonating for 3 minutes. The first minute was just on a single comfortable pitch with comfortable loudness, and then they were cued at the start of minute 2 to transition to comfortably doing pitch glides. So that's what they did for minutes 2 and 3. We had these reusable plastic cups with a lid and a straw. They were filled about halfway to 10 centimeters, and the straw was submerged about 2 centimeters below the surface of the water. And again, this kind of setup is easy for any individual to replicate as long as they have a cup that's similar. So then the third condition was this combination steam and SOVT. So that was 3 minutes of the steam and 3 minutes of the SOVT exercise with a adding up to 6 minutes total. And we did counterbalance the condition order as well as the combination order. So for half the participants, they did steam SOVT, and the other half SOVT and steam as their combo. So let's dive into results. There were 36 data points that showed change from PTP before to after each condition. And what we found was there was enormous variability in the results within each condition and within each individual. So it was really difficult and frankly meaningless to look at the means and standard deviations. And it required us to take a deeper dive into various trends that we saw. So I'm going to walk you through that now. But before I do that, I want to talk a little bit about sound pressure level. Something that we found when we were looking at the SPL in the pre-warm-up measure was that for 5 out of the 12 participants on at least one of those days, their SPL was greater than 67, which seemed pretty loud to us for someone who was supposed to be speaking voicing at their quietest voice possible without whispering. So this finding could be for a variety of reasons. The first was because they were just not that familiar with the task and found the task difficult. Or it could be that they were physiologically unable to phonate that quietly. We ultimately determined that we think we can attribute this SPL level to difficulty with the task. The reason that we determined that was because for all of these people, for 4 out of the 5 of them, by the 3rd day or by the 2nd day, they were down to below 67 dB in the pre-warm-up scenario, which indicated to us that they really just had to become more comfortable with the PTP, because by the 2nd or 3rd day of the experiment, they were able to get their dB below 67. So with all that in mind, we eliminated the data points that had pre-warm-up greater than 67 dB. Then we looked at each participant within each individual to see what was the best overall out of the 3. And the best overall out of the 3 could either be the largest reduction in PTP, or for the few people who increased with each condition, what was the smallest increase in PTP. Everyone still had a best of the 3. So just looking at here, we see that steam was the best for 1, SOVT was the best for 3, and steam and SOVT were the best for 3. So each one of these strategies is represented in someone's best, right? So we're seeing that there's potential for all 3 of them. Now we want to look at these 9 data points. These were the data points where PTP and SPL both decreased. Now this is kind of what we expect with a warm-up strategy. We expect that as a voice is getting warmed up, it will require less subglottal pressure to generate phonation, and a person will be able to phonate at a lower loudness, right? So for these, you see that the mean decrease for this group was down 0.34 centimeters of water, and the corresponding decrease in SPL was down 2 decibels. Now, this is the collection of data points that is super fascinating and something I'm very excited to highlight. So this is the group of people, or the group of data points, where PTP decreased, but SPL increased. And this suggests to us increased efficiency because there's less subglottal pressure required and the person is phonating at a greater loudness. So here we're going to say, so these 6 data points across all conditions, the mean was they were going down 0.36 centimeters of water, and the decibels were going up, the SPL going up 1.7 decibels. And this occurred with three with steam, 2 with steam and SOVT condition, and 1 with the SOVT condition by itself. So what we're seeing here is 5 of the 6 of these data points occurred with steam in the picture. So this is suggesting to us that the potential to improve vocal efficiency may have something to do with the involvement of steam here. So that was something that we really want to zoom in on and look a little deeper at. So what are the big takeaways? Vocal warm-up strategies are not universally effective. The things that worked for some people didn't work for others. Things that didn't work for some worked really well for others. So what that means for us in providing these strategies to people we work with are that we need to customize the warm-up approaches for those people. And we found that for 3 people, like, they hated steam. So those are people that steam is probably not a good strategy to use with them. And interestingly, those same 3 people who hated steam was the worst of the 3 for them. And others we noticed were adding a lot of tension with their SOVT exercise. So what that's telling us is that we really need to take the time to teach and coach proper SOVT technique so that people are not adding tension and they're keeping the relaxed position that they need in order to get the benefits that we know are possible. So now I, again, want to talk a little bit about this, the potential for increased vocal efficiency with steam. So again, of these 6 data points where PTP decreased and SPL increased, 5 had steam in the equation, and just 1 of those 6 was SOVT by itself. So here we're seeing some potential benefit for vocal efficiency with steam, which is going to give us a lot of information on why it might work for vocal warm-up. So the benefits of steam, we're seeing obviously superficial hydration of the vocal folds. And then another added benefit is just sitting over that steam inhaler is calming and it is meditative. And at the same time, these 3 minutes when someone is just purely breathing steam, that is 3 minutes of vocal rest. So it's a calm meditative moment where a person is not using their voice. So the practical considerations. One thing, we really just want to figure out what are the qualities of specific individuals that make certain warm-up strategies better for them than other people, right? Like, what makes this strategy good for that person and not for this person, so that we can really customize the recommendations that we're making. Time of day is something we really want to look at. How does doing these exercises in the morning differ from doing them midday, evening? And current level of vocal function. How does it differ if someone had a really, really vocally taxing day and the next morning their voice may be feeling pretty husky? How does that impact this? And then we want to look at vocal warm-up versus vocal rescue. Vocal warm-up, just setting a person up for the vocal demands of their day. Vocal rescue, helping a person when they're already feeling the effects of vocal loading. How do we sort of fix that to a degree so that they can get through the rest of their vocal demands without injuring themselves? And then we want to look at real-world possibilities. And it seems that the 3 strategies, the 3 conditions we looked at are really feasible in the real world. Backstage, it's really easy for someone to have a cup with a straw in it. They can take a few minutes and blow bubbles into it while phonating. They could also sit at their dressing room station backstage during intermission and breathe steam. A teacher, maybe they're halfway through their day of teaching. This would be a really great opportunity during their lunch break to reset their voice with some of these strategies before going on to teach the rest of their day. So the long-term goal is to find efficient and practical vocal warm-up and rescue strategies that individuals can use to maintain a healthy voice and to implement during vocally demanding times. Thank you.